I was in Gaza from the 6th of June to the 31st of July 2024 as a medical team leader. My account today relies on that experience as well as MSF's work throughout the last 2 years. MSF is an independent medical humanitarian organization. We deliver care to people affected by conflict, epidemics, and disasters, and we speak out about what we witness. We've worked in Palestine since 1988. In Gaza today, over 1,000 of my Palestinian colleagues and around 40 international staff support hospitals, clinics, and water provision. Distinguished jury of conscience, please consider that we bear witness to Israel's deliberate mass harm of civilians, use of food as a weapon of war, and destruction of the healthcare system as three key elements in its genocide in Gaza, which takes place in the historical context of the Israeli occupation, colonization, blockade, and forced displacement of Palestinians across the occupied Palestinian territories. We witnessed mass deliberate harm of civilians through killing and injury. During my time in Gaza, in the so-called safe humanitarian zone, Al-Mawasi, makeshift tents crowded to the shoreline, gunships fired on the coastline while drones, helicopters, and jets were constant overhead. Explosions shook our windows and smoke plumes rose across the north, middle, and south simultaneously. Over a span of just 9 days in July 2024, I worked through 4 mass casualty events in the emergency room of Nasser Hospital in Khan Yunis. 4 Israeli attacks resulted in 162 people killed and 568 injured, those figures just from one emergency room, the one in which I worked. 2 of those attacks were within this so-called humanitarian zone. One of those attacks employed a double tap, whereby the first responder medical teams who arrived on the scene were also struck. I treated those patients that day, many of them still in their ambulance and first responder uniforms. In the middle of one of those 4 mass casualties, I saw our MSF anesthetist in the emergency room instead of the operating theatre. He explained his house had been destroyed and his daughters and nephews were in the ER somewhere. Later, we learned one of his nephews had been killed and another had suffered a spinal injury and paralysis. Within the next 5 days, my nurse colleague's son was killed, living in the middle area, and another nurse colleague living in Gaza City had 2 children killed and his third severely injured. Jury, please consider how the Israeli attacks were so indiscriminate through disregard for civilians that death became routine. Nearly every day, our wards echoed with the cries of my healthcare colleagues who were told that their family members had just been killed in their homes or while playing outside. Please note one scene I experienced working in the red zone in the emergency room during a mass casualty, which captures a glimpse of the daily horrific reality in Gaza. A 3-year-old girl injured, looking straight at me. She's breathing and alert, but when I remove her dressing, her entire left thigh is peeled down to the bone. Next to her, a woman covered in dust, appearing stable, breathing, eyes open, no obvious bleeding, until I took down the dressing and a large piece of bowel emerged. I kneel over a boy, blood on my knee, in his early teens on the floor, no facial hair yet. He's dead, not breathing. A man, most of his lower leg mangled, a boy with his face almost entirely burnt, a woman whose entire back is burnt with shrapnel and melted clothing. A girl taking her last breaths alone. At least she had the dignity to be on a bed. These are just 7 of the 730 injured or killed in 9 days in one emergency room in which I worked a year ago, and the same violence has continued every week that there hasn't been a ceasefire. Members of the jury, I would also like you to consider that during my time in Gaza in June 2024, the Nusayrat hostage rescue produced catastrophic civilian casualties, something I witnessed with my own eyes. The disproportion between the 4 Israelis rescued and the nearly 980 Palestinians killed and wounded that day is an affront to humanity. The entire trauma system was overwhelmed from middle area to south. In our trauma unit in Nasser alone, we took in 19 patients transferred from Al-Aqsa Hospital. The last child admitted from that attack was discharged 42 days later from our ward. He'd suffered an amputated forearm, a brain injury with memory loss and seizures, and still had a metal external fixator attached to his femur. Less than 7 days after that attack, as I waited to cross the Netzarim corridor, I witnessed the murder of 2 fishermen on the beach. This was roughly 2 kilometers from the buffer zone. Each was killed with a single shot from behind as they ran away, one to the neck and one to the heart. Israeli authorities denied us permission to render first aid or retrieve the bodies. Their friends crept up the beach, retrieved the bodies, and carried them away, still clutching one of their fishing nets. 2, how Israeli authorities used food as a weapon of war. The deliberate use of food as a weapon in Gaza saw hunger reach unprecedented levels, with famine confirmed by the IPC in August 2025, as you've heard. This is not hunger, it's deliberate starvation. At the MSF clinic in Gaza City, in the north of the Strip, the number of people enrolled for malnutrition by the second week of July had quadrupled in the previous month, while rates of severe malnutrition in children under 5 tripled in 2 weeks of July alone. In Gaza City, as of August the 9th, we had 1,599 people enrolled for outpatient malnutrition treatment. 42% of those children are under 5 years old, and over half are pregnant and breastfeeding women. A week-long survey at our clinics across Gaza this July showed a quarter of pregnant and breastfeeding women and children were malnourished. Our 4 outpatient feeding centers were overwhelmed, facing demand driven by deliberate starvation. Members of the jury, during this time, people were forced to seek food at the Israeli and UN-led militarized food distribution sites run by the so-called Gaza Humanitarian Fund, GHF. Distributions at GHF sites were accompanied by extreme violence. Palestinian men, women, and children seeking food came under fire from Israeli soldiers and from American security contractors. Our teams on the ground treated people with gunshot wounds, barbed wire lacerations, and crush injuries from stampedes, all sustained while trying to receive aid at GHF sites. Between 7th of June and 24th of July 2025, in just 6.5 weeks, in just 2 of our facilities, we received 1,380 injured individuals and 28 dead from 2 GHF sites.